Oral contraceptives. Oral contraceptives birth control pills are hormone-containing medications that are taken by mouth to prevent pregnancy. They prevent pregnancy by inhibiting ovulation and also by preventing sperm from penetrating through the cervix. Some advantages of the pill include: it does not interrupt sex. It usually makes your bleeds regular, lighter and less painful. It reduces your risk of cancer of the ovaries, womb and colon. Some disadvantages are: it can increase your blood pressure. It does not protect you against sexually transmitted infections. Breakthrough bleeding and spotting is common in the first few months of using the pill. The most common side effect of combined oral contraceptive pills is breakthrough bleeding. Women will also complain of nausea, headaches, abdominal cramping, breast tenderness, and increased vaginal discharge or decreased libido. Transdermal patch. A transdermal patch acts as a carrier for a drug, holding it until it's applied. At the point of application, the patch's adhesive secures it to the skin, and the drugs contained in the patch will begin to permeate into the bloodstream. The advantages and disadvantages of transdermal patch is that it reduces toxicity and local irritation due to multiple sites for absorption and offers the option of avoiding systemic side effects. However, the transdermal route of delivery for many drugs is limited since very few drugs can be delivered at a viable rate using this route. Possible side effects or risks are difficulty falling asleep or staying asleep, headache, dry mouth, stomach pain, skin irritation, itching, swelling, or redness in the area where you wore the patch. Vaginal ring. How is a vaginal ring used? To use a vaginal ring, you squeeze the ring and insert it into your vagina like inserting a tampon. It stays in your vagina for 3 weeks. You then take it out and throw it away and wait 7 days before inserting a new ring. Advantages of using vaginal ring. It doesn't interrupt sex. It's easy to put in and take out, and you don't have to think about it every day or each time you have sex. And the disadvantages are: you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. Possible side effects or risks are increased risk of blood clotting problems, heart attack, stroke, liver cancer, gallbladder disease, and high blood pressure. Breakthrough bleeding or spotting, skin irritation, breast tenderness or pain, menstrual pain, headaches, nausea or vomiting. Subdermal implants. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. Advantages of subdermal implants include long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantages you may experience during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. Possible side effects are nausea, stomach cramping or bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation or discharge may occur. Hormone injections. The hormone injection prevents pregnancy by injecting a synthetic version of the hormone progestogen, called depomedroxyprogesterone acetate, or DMPA. Advantages of hormone injections are: each injection lasts for either 8 or 13 weeks. It does not interrupt sex. It's an option if you can't use estrogen-based contraception. You do not have to remember to take a pill every day. It's safe to use while you're breastfeeding. And the disadvantages are: your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injections, and it does not protect you against STIs. Possible side effects or risks are: some people may put on weight when they use Depo-Provera or Cyanopress contraceptive injections. You may experience side effects like headaches, acne, hair loss, decreased sex drive, and mood swings. Intrauterine device. An intrauterine device IUD is a piece of T-shaped plastic about the size of a quarter that is placed inside the uterus to prevent pregnancy. 2 types of IUDs are available. One is covered with copper, the other releases the hormone progestin, and the advantages are: it protects against pregnancy for 5 or 10 years, depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. And the disadvantages are: your periods may become heavier, longer or more painful. Though this may improve after a few months start, it does not protect against STIs, so you may need to use condoms as well. Possible side effects or risks are: spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods. Male condoms. The male condom is placed on the penis when it becomes erect. It is unrolled all the way to the base of the penis while holding the tip of the condom to leave some extra room at the end. This creates a space for semen after ejaculation and makes it less likely that the condom will break. Some advantages of using condoms: when used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. The disadvantages are: condoms may decrease sexual sensation. Some people are allergic to latex rubber. Condoms may break or leak. Condoms have no side effects. Most people can use condoms with no problem. There are no side effects. Rarely. Latex rubber condoms can cause irritation for people with latex allergies or sensitivities. Female condoms. Female condoms are a barrier method of contraception worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. A female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has been put in. Advantage of female condoms. Female condoms help to protect both partners from STIs, including HIV. Disadvantages of female condoms: they can slip out of place during sex. They can irritate your or your partner's skin. They might make the sensation of sex less intense. They're slightly less effective at preventing pregnancy and STDs than male condoms. Female condoms do not have any side effects except to individuals who are allergic to latex. Surgical methods. Example of surgical method is tubal sterilization, also known as tubal ligation or having your tubes tied, is a permanent method of contraception that you can choose if you are sure that you do not want to have children in the future. Using keyhole surgery. The surgeon puts clips on the fallopian tubes to block the sperm and egg from meeting. Advantages of surgical sterilization tubal ligation include the following: it is a very effective and permanent method of contraception. It does not affect sex drive. It doesn't interfere with spontaneity of sexual intercourse. There is no effect on your normal hormone rhythms or periods. Some of the disadvantages of surgical sterilization include the following: it requires surgery, usually under a general anesthetic. There is a risk, albeit low, of surgical complications such as internal bleeding, infection or damage to other organs. Possible side effects or risks using or having surgical method as contraceptives. Neoplastic diseases. The forms of neoplasia that are of greatest concern with the potential effects of OC use are breast cancer, cervical cancer, endometrial cancer, and ovarian cancer. Natural methods of contraceptives. Abstinence is the most effective form of birth control. If two people don't have sex, sperm can't fertilize an egg, and there's no possibility of pregnancy. Advantage and disadvantage of using abstinence is it protects people against STDs from vaginal sex, but STDs can also spread through oral genital sex, anal sex, or even intimate skin-to-skin contact. For example, genital warts and herpes can spread this way. Complete abstinence is the only way to guarantee protection against STDs. Possible side effects or risks of abstinence: experiencing aches and pains, increase in blood pressure and stress levels, tightening of the vaginal canal for folks going through menopause, decreased prostate health, spontaneous arousal levels may drop. Calendar method. The rhythm method, also called the calendar method or the calendar rhythm method, is a form of natural family planning. To use the rhythm method, you track your menstrual history to predict when you'll ovulate. This helps you determine when you're most likely to conceive. Advantages of using calendar method. Calendar-based contraceptive methods prevent pregnancy by monitoring the fertile periods during the menstrual cycle. The standard days method can be used by any woman who wishes to prevent pregnancy and experiences regular menstrual cycles, between 26 to 32 days in length. Disadvantage of using calendar method. The disadvantage using the rhythm method is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. There is no possible side effect in using calendar method. Basal body temperature. Basal body temperature can be used either as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Advantage of basal body temperature is it's not expensive and doesn't have any side effects. The disadvantage of basal body temperature method is may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no protection from sexually transmitted diseases. Cervical mucus method. To use this method, record your cervical secretions for several cycles. Starting the day after your menstrual bleeding stops, observe and record your cervical secretions on a daily chart, either on paper or with an app designed to track fertility signs. Advantages of the cervical mucus method. ISD identify fertile times to help you gauge the best days to have or avoid unprotected sex. One disadvantage is that this method is not always easy to learn without the guidance of your OB or GYN or doctor. Using the cervical mucus method to promote fertility doesn't pose any risks. Likewise, using the cervical mucus method for birth control doesn't pose any direct risks, but it doesn't offer protection from sexually transmitted infections. Symptothermal method. Symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. The advantage of symptothermal method is easy to learn and an effective FABM for attempting to achieve or avoid pregnancy. There are no devices or drugs to use that harm the body or a couple's fertility. Disadvantages of the method are that intercourse must be restricted to only 7-13 days of the cycle. Women must take their temperature daily. The method cannot be used during fever episodes, and the method is inappropriate for use during lactation or near menopause. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. However, this technique shares the same disadvantages that each of these techniques has individually. Ovulation detection. An ovulation detection is a home test by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone LH in the urine. A rise in this hormone signals the ovary to release the egg. Advantage of these tests check the levels of this hormone. By detecting a surge in LH, it helps predict when you will ovulate. Knowing this information helps you and your partner time sex for pregnancy. Disadvantages include limited detection. Ovulation tests detect LH levels, but they don't give you an exact date of ovulation. Eggs may not emerge even after an LH surge. Some people experience signs and symptoms of ovulation. These can include the abdominal pain or cramps, bloating, slightly elevated body temperature, changes in cervical mucus and saliva, and breast tenderness. Coitus interruptus. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available for primary use or use as a backup method. Coitus interruptus, or withdrawal as a contraceptive technique, does not make use of artificial devices. However, it does have disadvantage. One of them is, men discharge a small amount of semen before ejaculation.
Thank you, Bob.